morning. Welcome to the 2021 Dr. Matthew Walker Legacy Breakfast. We are excited that you have taken the time to join us today to celebrate our community leaders, our future workforce, our work and success over this year as an organization. We are going to hear from great people about great things. And I know that we are all tired of hearing the word pivot. So we're not going to pivot. We're just going to shift our gears today and learn how we have all been shifting through this time to continue to raise our bar to excellence. So again, welcome to the 2021 Dr. Matthew Walker Senior Legacy Breakfast. Next, we will have the Reverend Dr. Judy Cummings. She is a staple, strong supporter, champion of the North Nashville area. Many of you know her for her work as the senior pastor of the historic New Covenant Christian Church. She is the second vice president of the Nashville MWCHC branch, chair of membership for Nashville Organized for Action and Hope, or NOAA, co-chair for the Moving Forward Transit Plans Initiative, and co-chair of the Anti-Racism and Pro-Reconciliation Commission for the Tennessee Region Christian Church. Reverend Dr. Cummings has contributed to help the community through her creation of the beloved community. She has received numerous awards, numerous recognitions, numerous accolades, and we are grateful for her time this morning. She will provide our invocation. Reverend Dr. Judy Cummings.
Thank you. Let us pray together. Almighty God, who is ever present with us today we pause to honor the life of Dr. Matthew Walker Sr., whom you raised up as a highly respected teacher and surgeon, a pioneer in modern medicine. God, your word says that without a vision, the people perish. And so, God, we thank you that you have given this vision, God, to Dr. Matthew Walker. God, we thank you that we did not perish, but rather we have flourished because of this wonderful vision for community-based medicine. Because of this great vision, empowered by compassion, smart, sophisticated African-American doctors, both medical and surgeons, and even nurses, were raised up to provide care for the least of these, extending your healing grace and mercy to many. Because of this great vision, powered by compassion, it included surgeons trained by him, such as Dr. Dorothy L. Brown. Because of this great vision, powered by compassion, many poor and underserved of all races were treated with dignity and respect. Because of this great vision, powered by compassion, many a college student's tuition was paid, and Omega Psi Phi fraternity was enriched. God, we thank you for the man, for the vision, for the visionary, for the legacy of Dr. Matthew Walker Sr. Because of this great vision, powered by compassion, today there exist several Matthew Walker comprehensive healthcare centers, making quality healthcare accessible to all. Thank you, dear Lord, for the amazing visionary Dr. Matthew Walker Sr. God, now we ask that you would bless this annual legacy breakfast. God, that you would bless each speaker, that you would bless each honoree, and the people of God said together, amen.
Thank you, Reverend Dr. Judy Cummings, for such a beautiful prayer meditation. Next, we will hear greetings from our very own Clarksville Mayor Joe Pitts, Nashville Mayor John Cooper, and Congressman Jim Cooper.
Well, good morning, everybody. My name is Joe Pitts. I'm the mayor of the beautiful city of Clarksville, Tennessee, and it is my honor and pleasure to be with you this morning at the annual Legacy Breakfast, honoring the staff and the work of Dr. Matthew Walker and the Matthew Walker Comprehensive Health Center. I look forward to hearing Dr. Dewey in her keynote address today, and we're also honoring two people who are important not only to the healthcare environment and industry and work that's done across our state, but across the country. Dr. James Hildreth, thank you, sir, for your outstanding work. And to my dear, dear friend, Representative Harold Love. Representative Love, you represent your district and our state with such distinction, and it's a great pleasure to share the screen with you this morning and to be in your presence. So thank you again to both of those for your work. It seems impossible that it was almost 14 years ago now that Cynthia and I learned that Matthew Walker Comprehensive Health Center was going to establish a clinic in our community. And since that time, they provided outstanding medical and dental care to the citizens of our community, both underserved, served, and uninsured. And so I want to say thank you to the staff especially for the outstanding work you do. You've done some extremely good work, and we are so proud of you. Thank you to Katina Beard for the invitation to be with you this morning. Katina, you're doing a great job as CEO of Matthew Walker, and we thank you for your work in making medical care possible for those who may not have a medical home. So I encourage you to give today, to be a part of this breakfast, not only physically, but financially. Your gifts will go a long way. So thank you for what you do. Thank you for allowing me to be here, and we look forward to being a part of the rest of the event today. God bless you.
Thank you, Katina. I'm so grateful for your leadership at the Matthew Walker Comprehensive Health Center, and I also want to recognize today, of course, State Representative Harold Love, Mayor Joe Pitts, Nashville's family doctor, Dr. James Hildreth, Congressman Jim Cooper, who also is my brother, and all the other distinguished guests here today. I am so honored to pay tribute to Dr. Matthew Walker Sr. Dr. Walker was a giant among Meharry alumni and one of our nation's leading surgeons and educators. It's incredible, but by the time of his passing in 1978, he had educated nearly half of all the black physicians in America. Nashville is so proud of that. Dr. Walker was known for both his brilliant mind and his compassionate spirit. And today, his legacy, one of hope, healing, and dignity, lives on at the Matthew Walker Comprehensive Health Center. Now, it's been a long and difficult year for everyone, but today, with your help, Nashville is turning the corner. After the March 3rd tornado, the Matthew Walker team were among the very first on the ground in North Nashville to serve storm victims from their mobile clinic in front of Lee Chapel AME. And just 5 days later, after our first confirmed case of COVID-19, they went straight to work to keep our neighbors safe and supported. In times like these, Nashvillians need healthcare providers they know and trust. Nearly 2,500 people have already been vaccinated at Matthew Walker, and many more will be immunized because of the special relationships they've built with our neighbors. But remember, this life-saving work is only possible with your generosity. And I know that Nashville can count on your support. And together, we will make sure the Matthew Walker Comprehensive Health Center serves generations to come as an enduring tribute to the great Dr. Walker's legacy. So thank you, be well, and stay safe.
I could not be prouder to honor two remarkable Tennesseans, Dr. James Hildreth and the Reverend Dr. Harold Love, Jr. I'm so delighted that Matthew Walker is honoring both these titans in their fields. Matthew Walker Sr. was one of the best doctors in America or the world. He deserves to be honored. There's no one, I think, who deserves more his legacy award than Dr. Hildreth, who's an absolute giant as well. We are so proud of his leadership at Meharry and his leadership on fighting disease all over the world. And it's hard to organize human beings. Sometimes it's tougher than even finding a cure for a disease. But Harold Love Jr. has devoted so much of his life to not only serving as pastor, but also serving in our state legislature, which has got to be one of the hardest jobs ever. But his passionate advocacy for health care for all and quality health care for all is so much what we need right now. So I'm delighted to honor both these outstanding men, Dr. Hildreth and Reverend Dr. Love. These are awesome individuals, and I am proud to help them in any way that I possibly can.
Matthew Walker Comprehensive Health Center is proud of its name and the man who it represents. Born in 1906 in Louisiana, Dr. Matthew Walker moved to Nashville in 1934 to begin his medical training. For 30 years, he was the chairman of the surgery department at Meharry Medical College. He was pivotal in expanding the surgery program at Meharry, where he personally trained half of black surgeons in the U.S. during his tenure. His desire was to provide access to medical care and jobs for the underserved and uninsured in Nashville. He founded Meharry Neighborhood Health Center in 1968, which was later renamed Matthew Walker Comprehensive Health Center. The center has grown from a single facility to a community staple of comprehensive health across 3 locations throughout Middle Tennessee.
He would travel to Mount Bayou, Mississippi to help train other black students at the time because they could not be trained in the hospitals there because of segregation.
A goal of his that has now been in motion for more than 50 years at all 3 of Matthew Walker Comprehensive Health Center's locations. Matthew Walker is open to all, but it also helps reflect the community it serves with their diverse group of medical professionals.
We are a diverse organization. We make sure that our offices represent the communities that we serve.
Elizabeth Frazier, now a patient at Matthew Walker, explains how it has actually been a staple in her life for decades.
Matthew Walker was a place that I would refer students to, those who didn't have insurance and even those who did.
The Community Health Center provides many services for their patients to help make it a one-stop shop for those in need.
In Nashville, we have what we consider the full comprehensive model of services. And so along with primary care services that are provided by physicians and certified nurse practitioners, we also have a significant oral health program that includes 4 dentists, 2 dental hygienists, and now 6 dental residents in partnership with the University of Tennessee and Ascension. We also have lab services, which includes plain film radiology and mammography. We have on-site laboratory services, pharmacy services, behavioral health services, which includes opioid addiction treatment services. We have social services, case management, outreach and enrollment. I'm always forgetting something, but as you can see, those services are very inclusive to meet the needs of an individual.
They also support their older group of patients with different programs and activities in which they can participate in.
Seasoned adult programs are educational, they're fun, they're mind challenging, they create a sense of togetherness that a lot of people don't get because they don't have family that is close by or that is even living, but they're like family.
Along with their services, safety and awareness are also some of the most important things to the Matthew Walker team. As 2020's coronavirus pandemic set in, Matthew Walker knew they had to take action to keep their patients and staff safe.
We will continue to make sure that we have masks available for our staff and for our patients in this environment, that we are diligent about our cleaning, that we have our supplies on hand, that we're able to clean our lobbies and our chairs, and that we don't crowd them back.
Increased measures have been taken for staff and patients alike to ensure that safety.
Matthew Walker has not turned its back on the community. They have constantly came up with different ways to make it safe. The mask, one person at a time, meeting you at the door, speaking to you ahead of time, providing the hand sanitizers, the mask at one time. Now they ask people to bring their masks with them, but most of us now have masks. So they have been doing a great professional job.
As mentioned, the healthcare center is open to all, but some still sit in the stigma that affordable healthcare means lesser quality, which is not the case. Patients like Meredith Pittman even took the time to write a letter to the practice expressing her gratitude for how comfortable the team made her feel.
Initially, when I wrote my letter, I was just talking about, from the time you walk in to the lady that's actually down there now, who is, doing her job and testing, taking temperatures, for COVID and everything, to the people at the front desk and, where they send you. Everybody is just so friendly and they make you feel so comfortable. And that's very rare.
As the world continues to navigate its new normal amidst a pandemic, one thing is staying steady. Matthew Walker and its mission to serve all.
Thank you, Mayor Pitts, Mayor Cooper, Congressman Cooper, for your warm greetings and support of our breakfast today. Next, we will have Dr. Christy Mars, whom I consider the firstborn of our children of Matthew Walker Comprehensive Health Center. She is the oldest daughter of Michelle B. Mars, who was our visionary, our CEO at the time when this facility at 1035 14th Avenue North was built. She was my mentor, my friend, and we are always so very happy to have Dr. Mars here with us to celebrate again the legacy that has continued, not only in the name of Dr. Matthew Walker, but also in the name and spirit of Mrs. Mars. So next we will hear from Dr. Christy Mars.
Thank you, Katina, for that wonderful introduction. It is definitely an honor to be here today. Today, I have the honor of introducing the 2021 Michelle B. Mars Legacy Award recipient. This year, we are honoring Reverend Dr. Harold Love. And if you know him, you know his commitment to service in the national community. I had an opportunity to read his bio, and Reverend Love definitely has a commitment and a long history of service to the national community. Reverend Love came to Lee Chapel AME in 2016, and under his leadership, Lee Chapel has been an impactful pillar in the Nashville community, especially in this last year. As we all know, Nashville has been hard hit. It began in March of 2020 when a historic tornado came through the North Nashville community, and Lee Chapel, under Reverend Love's leadership, stepped right up and stepped in to provide a safe place and a shelter for those who had been significantly impacted by the tornado. And as we know, soon after that, COVID-19 impacted this country. And again, Lee Chapel, under Reverend Love's leadership, stepped up and became a safe haven in the North Nashville community. Under his leadership, Lee Chapel was a provider of food, and has also been a place where the Nashville community could come and receive vaccines. It is amazing to see the work that, under his leadership, Lee Chapel AME has been able to do. If you know Harold Love, you've seen him in the community, you know what he has, a commitment and a compassionate heart for service. And through his work, and leadership at Lee Chapel, I definitely understand why his name rose to the top this year as a Michelle B. Mars Award recipient. It's an honor to present him with this award today.
Thank you, Dr. Mars, for that wonderful recap of the work that I've been able to do while at Lee Chapel African Methodist Episcopal Church. And I'm grateful to the Matthew Walker Comprehensive Health Center for this opportunity to receive the Michelle B. Mars Advocacy Award. I'm grateful to the legacy of Dr. Matthew Walker Sr. and all that he has done in our community in the past to make sure that people receive proper health care. And it's because of that that I'm also able to advocate for increased health access and reducing health disparities in our community. So thank you once again for this wonderful opportunity, and thank you for all that you all do as we partner together to make sure that our communities are indeed safer and healthier.
So I know our next speaker, Dr. Matthew Walker III, is very acquainted with State Representative Love, having grown up here in Nashville together. And so we both congratulate him on his work and congratulate him on being the recipient of this year's award. Some of you know our next speaker, Dr. Matthew Walker III, the grandson of our founder, Dr. Matthew Walker Sr. We always enjoy his stories and reviving our love for Dr. Walker and his legacy. For those of you who have not heard him, you are in for a great treat. Next, we have Dr. Matthew Walker III.
Thank you, Katina Beard, otherwise known as Queen B. I am so happy, so pleased. Good morning, everyone. We are at our Matthew Walker Senior Breakfast. And I know, knowing my grandfather, how much joy he would find in this. Not just in the continuance of the legacy that has been navigated so well by leadership like Katina Beard, Kathy Hunt, and Julie, but that we have done it in the spirit of his original mission. Grandpa was a man of vision. Every day he woke up, he thought about and talked about not what I just did, but what I can do next. He was always a next man. And so the legacy breakfast is a way to remind us every year that we have the opportunity to make a difference in this community. And thanks to the leadership, we have been doing that. I have the austere pleasure of introducing to you all Dr. James Hildreth. Dr. James Hildreth and my grandfather were very similar in spirit. What I have learned about Dr. Hildreth is that he is a man that blurs the lines between disciplines. He is what I call a polymath. My grandfather was considered a polymath, where he was able to make blurred lines between disciplines, that there was no area of intellectual engagement, no life of the mind that he was uncomfortable navigating through. James E.K. Hildreth Sr., Ph.D., MD, has transformed institutions and lives through a unique combination of skills, expertise, passionate drive, and he seeks to achieve organizational success by nurturing passions, developing confidence in others. Dr. Hildreth's enthusiasm and love for the work he does inspires others and draws them into broad visions and new directions. Currently, as president and CEO of Meharry Medical College, Dr. Hildreth is leading the technological, academic, and clinical transformation of the nation's largest Black academic historic health science center, focused on the future of an organization with challenges. Dr. Hildreth holds an MD from Johns Hopkins University School of Medicine. Dr. Hildreth holds a PhD from Oxford University. And Dr. Hildreth holds a Bachelor of Arts from Harvard University. That is a pedigree. He is a Rhodes Scholar who has been elected to the National Academy of Medicine. That is the most elite and elevated professional organization in medicine. That's where the geniuses hang out. He has received numerous awards and recognition, including honorary degrees for his scientific accomplishments, leadership, service to disadvantaged communities, and mentorship of students and junior colleagues. He has served in numerous national scientific councils, including current membership on the Advisory Council to the NIH. Dr. Hildreth currently serves as chair of the Board of Trustees of St. Jude Research Hospital, Graduate School of Biomedical Sciences. He also serves on other boards, including National Healthcare Council, Natural Health, Boy Scouts of America, and the General Board of Higher Education of the United Methodist Church, of which my grandfather was also on the board of. That being said, I consider Dr. James Hildreth to be a part of the elite, august pantheon of intellectual leaders, of servant leaders, and of downright spiritual richness, just as my grandfather was. I am delighted and honored and humbled to present this year's Dr. Matthew Walker Sr. Legacy Award to Dr. James Hildreth. Thank you.
Good morning. And thank you for that really kind introduction. Dr. Matthew Walker Sr. was an amazing, gifted surgeon. He was a scholar of the highest order and a supreme educator, and as you heard, was responsible for training a large number of physicians by the time he was done with his career. He was also a really impactful leader, and he did that by example and also by the way he carried himself on a daily basis. The other thing that I really admire about Dr. Walker Sr., he was a committed father and committed husband who really loved his family and did everything he could do to support them and nurture them. Dr. Walker elevated medicine itself by what he did and how he did it. He certainly elevated African Americans in medicine, for sure. And it goes without saying that among Meharry's alumnus, he was an icon. Everything that we've done since the time he was here was because he did what he did. We're able to change our curriculum, attract really gifted students, and train amazing leaders and physicians. So, but the other thing to know is that to achieve all of this in the context of the time he lived in, with the politics and social constructs, leaves me in complete awe because I know how hard it must have been for a Black man to achieve what he achieved the way he achieved it. And to be quite honest, he must have been truly superlative to be recognized by his white colleagues the way that he was. So he inspires me on a daily basis. He has certainly inspired many, many others to want to do what he does. And so for me to receive this honor in his name and to be mentioned in the same breath as Dr. Walker Sr., and genuinely telling you that this is one of the most cherished awards of my career. And I'm humbled by it. And I thank you for recognizing me in this way. Let me also thank Katina Beard and the board and staff of Matthew Walker Comprehensive Health Center for continuing Dr. Walker Sr.'s legacy in such an amazing way. We look forward to continued partnership to achieve the goals that we share in common, which is to provide healthcare to those who need it the most. And again, thank you so much for this honor. Again, in my whole career in life, this will be one of the most cherished recognitions that I have. Thank you again.
Good morning. My name is Sandra Long Weaver, and I am the fundraising chair for the Matthew Walker Senior Legacy Breakfast. This year, we are presenting 4 scholarships to Meharry Medical College students. We have a new scholarship this year, which will be presented by Dr. Christy Mars, whom you have already met, and she is presenting 2 scholarships named in honor of her mother. And we also have 2 scholarships that will be presented by Matthew Walker III, whom you've also met this morning, and he will be presenting 2 scholarships to students that are named after his grandfather, Matthew Walker Sr. The scholarships are going to 2 students in graduate school and 1 student in dental school and another student in medical school. Our committee had a very difficult time selecting the students because they're all very academically talented and very active in the community, which is what we want for the students who are being presented awards this year. So thank you.
Thank you for that introduction, Sandra. Today, it is a great honor again to present the Michelle B. Mars Legacy Scholarships. This year, we had phenomenal applicants, and it was definitely a challenge to choose from those who applied. But the 2 that we narrowed it down to are amazing candidates, and I'm so excited today to present these awards. Our first award recipient is Melissa Bassett. Melissa is a Ph.D. student in the neuroscience department, which is outside of my own department, a department that is very close to my heart. Melissa has completed extensive research and is a published author as a first-year graduate student. Kudos to you, Melissa, for those amazing accomplishments already. Melissa has a long list of academic achievements, and if I had more time, I would definitely highlight how amazing of a student she has been up to this point. Her achievements are beyond impressive, and she has definitely a heart for academics. And it's an honor to present her today for Michelle B. Mars Legacy Award Scholarship. I know if my mother was here, she would be bursting with pride for you to be her first award recipient.
Hi, thank you so much, Dr. Mars. It is such an honor to have been selected as a recipient of the inaugural Michelle B. Mars Legacy Scholarship. Thank you, Dr. Christy Mars and the Mars family and the Matthew Walker Comprehensive Health Center for making this opportunity possible and for allowing students like myself to honor your mother, Miss Michelle, and continue her legacy. Thank you so much.
Thank you, Melissa, for again applying for the scholarship and for being such a phenomenal student. Our next recipient is Ashley Leon. Ashley is an MSPH student at Meharry who is interested in epidemiology and health policy. And again, when I read her application, I was blown away by her achievements and her dedication to the public health field. Ashley has a commitment and dedication to serve the community and has professional goals in public health to combat health disparities at the community level. And again, when I read her application, I just saw my mom come up off the screen, and I know she would be excited about Ashley being an inaugural recipient of this award. I believe Ashley will be a powerhouse in the improvement of care of the beloved community. And so I'd like to introduce to you Ashley Leon, the second award recipient for this year's Michelle B. Mars Legacy Award.
Hi, everyone. It's a pleasure and honor to be here today. I would like to thank the Mars family and Matthew Walker Comprehensive Health Center for making the Legacy Award possible. And thank you for awarding me with this incredible opportunity. It is with the help of your generosity that's allowing me to continue into a prosperous career in public health. I'm incredibly grateful and would like to thank you very much again for your continued support of my academic endeavors.
I'm here, glad to be here for the breakfast. I represent the progeny, the family progeny of Dr. Matthew Walker Sr. And we've established the Matthew Walker Family Foundation Trust. As a part of that trust, we tried to find students who represent the ethos that we think Grandpa both taught and had. Grandpa would say, I did well with my students because I started with good wood. You can't carve rotten wood. So when we identifying students, like we have here with Aliah Billings, we have identified someone who represents that excellence is a baseline, and her work in dental school has been without peer. She blurs the lines between areas of interest. She's not just focused on dentistry, she's focused on service, she's focused on distributing those things she learns in dental school to a community, to making a broader impact, to have a ripple effect of her training. And that's exactly the phenotype of students that Meharry is trying to train and that Grandpa voraciously sought. So it's with pride and pleasure that I award you with the Matthew Walker Sr. Scholarship Award for academic excellence. Thank you for your hard work. Dr. Billings.
Thank you, Dr. Walker. Hello, my name is Aalieyah Billings, and I am a third-year dental student at Meharry Medical College. I am honored today to be a recipient of the Dr. Matthew Walker Sr. Legacy Scholarship. His dedication to the mission and vision of Meharry Medical College is what opened the doors for me to serve as a future healthcare leader and to become a pillar of my community. This scholarship will not only help me pursue my dreams of becoming a dentist in a world of ever-increasing costs for education, but by being able to propel forward, I indeed can lift as I climb. If I have seen further, it's by standing on the shoulders of giants. I have extreme gratitude for the efforts of my family, professors, mentors, and the Matthew Walker Comprehensive Health Center. Thank you for being a resource to me on my journey thus far and extending this award to me for my service efforts. I am truly grateful.
Hello, Leah. I'm Dr. Matthew Walker III of four. We call him Matthew Walker to the nth because we won't change the name. I have a 21-year-old son, which makes me all the more proud to see your trajectory. As being part of the Matthew Walker family, we kind of grew up with the mindset that excellence is your baseline. We've always been encouraged to consider the tradition of academics. Your sojourn at Meharry has proven that you are paying attention to your trajectory. And by awarding you with the Matthew Walker Senior Scholarship from the Matthew Walker Family Foundation Trust, we are asking to catch a ride to view your star rising. We want to be in your corner and celebrate the excellence that you've excavated from inside of you. We want to be here to encourage you, and we want you to be a part of the legacy of excellence. Please stay engaged. Anything we can do to help, let us know. Congratulations. Stay the course.
Thank you, Dr. Matthew Walker III and family, as well as the Matthew Walker Comprehensive Health Center. My name is Aalieyah Fonteh, and I am a second-year medical student at Meharry Medical College in Nashville, Tennessee. And it is an indescribable honor to be accepting an award from Dr. Walker III in honor of the legacy of his grandfather, Dr. Matthew Walker Sr., who paved the way to improve efficient, quality, and equitable care in Middle Tennessee and Mississippi. As an award recipient, I accept this award with a commitment to use my platform for service to the underserved, underinsured, and often forgotten populations, because I believe that healthcare is a human right. I recall the first day I walked into the Matthew Walker Comprehensive Health Center as an area health education scholar to start my clinical duties. I took a moment, I paused, and I read the bio on Dr. Matthew Walker Sr. in the lobby. I was humbled and in awe that this was the site that I would be doing my clinical duties, a site where I can see that the vision of one man, his dream, his initiative, and his compassion for humanity is still impacting populations. Dr. Walker Sr.'s legacy will be honored as I continue to train as a student and as I transition to an OBGYN physician who embodies his heart for compassionate and quality care that is accessible to vulnerable populations. Thank you very much for this award and for investing in me so that in the future I can invest in others as well.
Morning. Welcome to the Dr. Matthew Walker Sr. Legacy Breakfast. I would like to offer a brief introduction of our keynote speaker, Dr. Charlene Dewey. Dr. Dewey has remained steadfast in her pursuit of academic excellence and has amassed a vast collection of degrees, scholarly awards, and professional appointments. Through her role as Assistant Dean for Educator Development at Vanderbilt University Medical Center, I earnestly sought her mentorship. As her self-appointed protege, I was provided a pathway for providing excellence in medical education, physician leadership, and patient outcomes. I assure you, she is well prepared to guide us through the topic of preventing burnout and building resilience in this era of COVID-19 pandemic and other matters of grave concern. Dr. Dewey is indeed highly accomplished, and not too uncommonly found behind many great women. There is a solid, humble, and supportive man of Alpha Phi Alpha Fraternity Incorporated. Her husband, Dr. Wayne Riley, has also enjoyed countless successes and now serves as the reigning president of SUNY Downstate Health Sciences University. To this union, there are two daughters, Awesome and Phenomenal, whose formal names are Erin Elizabeth and Alexis Camille. Without further ado, please welcome Nashville's very own North Star, Dr. Charlene Dewey.
Thank you, everybody, for allowing me to be here today. I'm so excited to have time to speak with you about a topic that is definitely near and dear to my heart, which is helping healthcare providers and the teams that they work on. I'm going to share my screen so we can start with some slides to get us going. And in this presentation, I'm just going to say that I want you to wear your reflective caps. I want you to think about yourself as we're talking about this, think about the team that you work on and the benefit of addressing burnout and resilience that it can help support in the Matthew Walker Center. So the purpose really is for me to provide an awareness for identifying burnout and building resilience in healthcare providers and teams during the COVID-19 pandemic. My objectives are that you will be able to define burnout risks and the symptoms of burnout, categorize and compare the 4 strategies that support resilience, and then I'm going to give you my top 10 myth buster kind of tip busters on how to discuss approaches for sustaining resilience during the pandemic. And then I'll leave you with a couple of resources. So for our introduction, I'm going to try and make it fairly brief and then spend most of our time in burnout and resilience. Then I'm going to do the top 10 burnout busters at the end and leave you with a couple of resources before I close. So this is a quote that I often use and have used for years and years because it's so important. And it says, the medical academy's primary ethical imperative may be to care for others, but this imperative is meaningless if it is divorced from the imperative to care for oneself. And how can we hope to care for others, after all, if we ourselves are crippled by ill health, burnout, and resentment? And it goes on to say, if they are to heed the self-care imperative, medical academics must turn to an ethics that not only encourages, but even demands care of self. And so let's start with that, thinking about how we can demand care of self. This is a spectrum that we developed at Vanderbilt. We call it the Professional Health and Wellness Spectrum. And just in a quick overview of this, we look at the individual's physical, emotional, spiritual well-being and energy levels, and we look at their work and family relationships. In this initial zone, we call this our zone of wellness, and this is where people are professionally healthy, they're well, they have good coping skills and strong resilience. They're high-functioning, productive individuals with strong, healthy relationships. And this is the optimal zone. This is where we would like everyone to be. But we also know that in healthcare, sometimes we face stressors. And so this zone is the zone of stress, the second zone, in which we have to invoke coping mechanisms. And if those coping mechanisms are strong and the stresses are intermittent and spread out, then we can be resilient individuals during these times. We can still function pretty well, but there are times when we do have decreased productivity, or we might strain our relationships due to the stressful behaviors that we might demonstrate. This third zone is what we call the burnout zone. And this is where the coping mechanisms begin to start to fail. Individuals are no longer resilient. Their relationships start to suffer, their functioning can decrease, and their overall productivity starts to decrease. In our last zone, we call this the zone of impairment. And this is where individuals might have higher risks for mental health concerns, as well as substance use, and suicide starts to go up in this zone, especially if mental health and substance use are paired together. In this zone, there's very little coping mechanisms left. And the individual is fairly functioning barely at all. And we see significant family and institutional stressors and losses. And in these 3 zones, what we see as the result really is the behavior of the individual, not necessarily that they're stressed or burnt out, but we see that they are clearly demonstrating behaviors that we call undermining a culture of safety. This is why we look toward the zone of opportunity, where we can actually help individuals move toward the wellness zone, come out of the burnout and the impairment zone, and help manage stress so that they can help perform well on their teams. So the question that I have for you, we've been in COVID for a year now. And so my question is since you've been in COVID, how stressed have you been on average throughout this whole time? And if someone can launch the poll, you should see a question that asks this. And the first response is not at all stressed, a little stressed, stressed, very stressed, or extremely stressed. And we'll give you about 10 seconds to respond. Okay, so in this group overall, we've had 44%, just under half or so, that have a little bit of stress. But we also have 31% plus 17% plus 3%, which equals the other 50% of us that are experiencing stress or very stressed or extremely stressed. Thank you. You can close the poll. So that means that we are all experiencing stresses in different ways on average, and we're going to try and address how we prevent that from getting toward burnout. So if we look at burnout initially, there's a definition that comes straight out of the dictionary that says it's the exhaustion of physical or emotional strength or motivation, usually as a result of prolonged stress or frustration. So are we not in prolonged stress or frustration after a year of dealing with COVID and the uncertainties that it brought for us? Christina Maslach is basically the guru of burnout, and she describes burnout as a syndrome of symptoms experienced in response to chronic stress resulting from a major mismatch between the nature of the job and the nature of the person who does the job. And I love this definition because what it helps us recognize is that the mismatch is there and it's not an individual's problem. It's because of the nature of the job within that, which in that individual has to work. There are several risk factors that are associated with burnout, and this is a list that most will be able to see, but there's single individuals, especially for healthcare providers. Those related to gender vary based on age. So during residency training, males might have more burnout, but also early career women tend to have more burnout. The higher the number of children in the home when you're developing family problems. Actually, we have two peaks in that early career and then that mid-career slot for healthcare providers. And then those who experience previous mental health conditions, those with fatigue and sleep deprivation on a chronic basis, general dissatisfaction, alcohol or drug use, minorities especially during residency trainings and within different programs that they participate in, teaching and research demands. So that's basically like wearing multiple hats. Potential litigation, because of course that's a very stressful thing for each physician. Clinical burdens, productivity requirements, and what we call pajama time EMR all contribute to the risk of burnout. Dr. Maslach says that there are 6 sources of burnout that we can experience, and these can occur both in the work environment as well as the home environment. Most of these are pretty explanatory: work overload, lack of control, insufficient reward, unfairness, breakdown of community, and value conflict. Value conflict's not always so clear, so I give my own example to this. I initially went into medicine to serve the underserved and the minority populations related to healthcare. And then when I made a major job change, I didn't always have that same opportunity. And so it started to create what's called a value conflict for me, the value of what I came to do versus what I was actually able to do. So those are the 6 sources that we want to make sure that everybody looks for and identifies. And again, both work and at home. So what would it look like if someone has burnout? Symptoms are chronic exhaustion. I always say it's that last nerve and you're yanking it, okay, when someone constantly feels like they are exhausted. Cynical and detached is a big one. This is where the individual starts to see themselves as one side and the other side as everybody else. So me against the world kind of feeling. And then increasingly ineffective at work. This we don't see as strong in most physicians, but what it would look like is maybe lack of participation in certain meetings, not wanting to be included on team activities, decreased ability to keep up with the work demands for EMRs, things like that. And what burnout actually leads to is the behavior change, and that behavior that we start to say undermines a culture of safety. It also leads to professional isolation, avoidance, and interpersonal conflicts. Those only add more stress to the workplace or the home. And then what we start to see in the workplace, of course, is high turnover, people who leave because they don't want to deal with the stress and the conflicts that they're experiencing. So the consequences of burnout affect both the individual and those around them. And again, it's not necessarily an individual's fault. It's the mismatch that they're experiencing. So we need to keep that in mind and make sure that whenever we're addressing someone who might be at burnout, not to blame them as the individual, but to look at the system and look at the complexity of with which we have to address burnout with. So Maslach has this quote that I also like that says, the twin goals of preventing burnout and building engagement are possible and necessary in today's working world. These goals cannot be easily achieved by an individual. Rather, people have to work together to make them happen. And if we all commit ourselves to long-term process of organizational progress, we will be rewarded with workplaces that are more productive and resilient as well as humane. So, based on that little bit of an introduction into burnout, my next question is, how likely are you experiencing some of these symptoms that burnout might exhibit right now? So if we can launch poll number 2, the responses are not at all likely, somewhat likely, likely, very likely, or extremely likely. And we'll give you another 10 seconds or so to respond to this poll. Okay, so we have the biggest group, 39% somewhat likely, and then above that, 39 plus 33 plus 8 and 4%. So almost 80% of us are somewhere between somewhat likely and extremely likely. Thank you. You can close the poll. And this only emphasizes burnout is prevalent, and we need to make sure that we're addressing it as an organization. So now let's go ahead and start shifting gears and say, well, what can we do if we know that almost 80% of us are experiencing some signs of burnout? What can we do? Well, the first thing is starting to enhance your own individual resilience. And there are plenty of different sources out there about how to do that. These are the ones that I like that we focus on because there's a significant amount of control that the individual has in order to do these things to help support their wellness. And that includes self-care, managing energy, building your emotional intelligence, and practicing mindfulness. So in self-care, I use these wonderful smiley face, brightly yellow smiley faces to emphasize all the things we need to pay attention to in our self-care. Our healthy eating, this is actually a black bean burger, just in case anybody was wondering. Sleeping, getting enough sleep, actually waking up when your body is ready to wake up as opposed to an alarm clock. Committing to physical activity, sharing and loving intimate relationships. This is critical, and that includes lovemaking, sex, and things where individuals are very close with others, versus this next group, which is community, having a sense of community. That can occur within different areas of your job or within your family or within your networks of friends and colleagues. The next level, we have the learned individual. That's the person who feels like they have a purpose and they're committed to something. Then we have the person who takes vacations and downtimes, takes breaks, gets away from the stress of the work that they're dealing with. The next one is the hobbies. What things do you do that keeps yourself excited and engaged outside of your work? The next one is that spiritual awareness, the ones who find awe and excitement just in the day, the sunshine, to those who practice a religious practice around faith and a higher power or deity. And then our last one here is that positive person, someone who finds happiness and gratitude in almost everything they do, sometimes even despite the hard consequences and the circumstances that they're facing. Managing energy is the second one. And this, again, is something that we have a little bit of control on. So I want to emphasize this. This is from a Schwartz and McCarthy article from the Harvard Business Review. And it talks about how you manage energy. And they've looked at this in different organizations. And the more that the organizations practice this, then the more productive their individuals were, the happier their individuals were. So this includes your physical energy, your emotional energy, your spiritual energy, and your mental energy. And that basically means physical energy, taking breaks during the day, just getting up from your seat. If you work at a desk most of the time, taking a 10-minute break. Emotional energy is that part of finding happiness and joy and focusing on those things that create a sense of joy inside of you. The spiritual energy are those things that nourish your core, your personal values, your mission in life, and making sure that you're focusing to include some of those things during your day. And the last one is the mental energy. And that's when you're working to make sure that you have times to commit to the work that you're trying to do, focused attention, so that you are not multitasking and doing too many things at one time. The next one is building emotional intelligence. Everyone has emotions, and the question is, how do we build emotional intelligence? Because emotion influences our behaviors such that we can be reasonable in one instance and then almost irrational in the next. And so as we build emotional intelligence, there are several components that we want to support. Self-awareness, self-regulation, and management. I always start with those two when I'm training individuals on building emotional intelligence. But motivation, empathy, and social skills, listening, resolving conflict, and cooperation. And we know that most individuals don't get how to resolve conflict during college, medical school, or residency training. So it's a skill that actually has to be taught and learned. And the last one is practicing mindfulness. This is that purposeful training of your attention. We know that it increases self-awareness and self-regulation. And we have more than several thousand studies that look at how mindfulness can support well-being, self-confidence, creativity, and happiness. We also know that it can decrease stress and pain. And there are a variety of different methods that you can use, from meditation, prayer, journaling, art, and conversations. And so to finish up, I'm going to give you my top 10 burnout busters and hope that you will write these down. The first one is prioritize your wellness. Make yourself the number one to do on the priority list every day, because of those things, everything that you do for yourself will give positive ripple effects to those around you. Take time to build your own resilience and make it a goal, a purpose. Find something in one of those categories that you can work on. Prevent and manage stress. We can't take stress out of our lives, but what we can do is recognize when it's going to come, see if we can prevent it, and then manage it when it does. And that also takes training. Reducing the burnout and making sure that if you're at burnout, that you find a way to get out of it. It doesn't mean it ends your career or anything like that, but it just means you need help to get out of it. Managing expectations. So at home and at work, what's feasible? What do you need? Finding the ways that help make things easier for you to reduce those stressors. Listening to your needs. When your body says you're tired, get sleep. If your body says you're hungry, eat. If your body says it's time to go to the bathroom, take a break and go to the bathroom. Keep connected. Have that social network in and outside of work. It's needed for both. And then addressing those system sources of burnout, finding where they exist and helping to make it more efficient systems for people to work in. And the last one is seeking assistance. Asking for help is never a weakness, it's actually a strength. And the more we can actually work with others to help us, then the better we're going to be in the end. So just to close and let you know that there are several resources available out there. I'm going to highlight our state physicians health program, Dr. Michael Barron for physicians. This is a great thing. National organizations like the National Academies of Medicine, the American College of Physicians, and the AMA have a number of wonderful resources on their web pages. But don't forget, coaches, counselors, therapists, confidants, mentors, and peers can all serve as great resources. And I also emphasize the 1-800-273-TALK, which is the National Suicide Prevention number. And then lastly, at Vanderbilt, of course, we have our Center for Professional Health, where we offer women's retreats, leadership training programs in reducing burnout in their divisions, departments, and organizations. We have coaching available. We have a wellness resort that we're developing and an encouragement program. And you can look to our webpage for any of those resources. And so in summary, I just want to say thank you. Thank you for all you do. Thank you for what you do to serve the community here in Nashville, that your being is important and so valuable. Stress and burnout are significant problems for healthcare providers and their teams with or without the pandemic, and it just is emphasized during the pandemic. Within that, that means we need to find ways to support each other, support ourselves, support our colleagues, and resolve any organizational sources of burnout. I hope that you will all be safe, continue to take care of yourself, take care of your family and the ones you love, and to seek help if needed. Help those around you when they might not necessarily realize that they might be stressed or burned out. Help them as well, and then continue to care for all those wonderful patients. I'll leave you with this quote that says, "The first wealth is health." And then I also want to just briefly thank all the team, Kathy Hunt and the team that worked to put this together, all the award winners, Dr. Hildreth and Dr. Love, and the students, and just for the wonderful thing that Matthew Walker does for the community. Thank you all.
Thank you, Dr. Dewey, for such a wonderful presentation and information about burnout and then the burnout busters. It's been very helpful to me personally, and I look forward to implementing many of the strategic steps that you gave in your presentation. Thank you for your time. Thank you again for all who participated in this event. I want to say thank you to my staff, Kathy Hunt, Julie Morris, Tracy Henderson, the entire Matthew Walker Health Center team that helped pull all of this together. Thank you so much to Dr. Hildreth for your sincere and heartfelt comments. Thank you, Representative Love, Congressman Cooper, Mayor Pitts, Mayor Cooper. I want to thank our sponsors, our vision seekers, Amazon, Belmont University, HCA Healthcare, and TriStar Health, our vision builders, Mount Zion Baptist Church, Piedmont Natural Gas, Friends of the Vision, AARP, Amerigroup, Dr. Worthy, Bank of Tennessee, Dell Technologies, Tennessee Hospital Association, the Ivy Center Foundation of Nashville, and Vanderbilt University. Our scholarship sponsors, Dr. Christy Mars, the family of Dr. Matthew Walker Sr., and our media sponsors, Nashville Medical News and Tennessee Tribune. I want to thank each of you for participating this morning, all of our attendees, all of our panelists. Next, you will hear from our board chair, Jeff Teague. You got to unmute, Jeff.
Sorry. Thank you, Katina, and thank you all so much for joining us this morning. I want to take a minute to also congratulate Dr. Hildreth and Representative Love. Representative Love is a good friend, and I am a great admirer of both he and Dr. Hildreth. I also want to congratulate the scholarship recipients as well. It's been my honor and privilege to serve on the board at Matthew Walker for the past 4 years, and now to serve as the board chair. You already have heard about the amazing work the Matthew Walker Comprehensive Care Health Center does in guaranteeing the health and well-being of the diverse clients that we serve. In my time on the board, we've seen amazing growth and incredible change. You know, a year ago, COVID hit, and it set us back on our heels, but just a little bit. But through the great leadership of the board and the compassionate, passionate dedication of our incredible staff, we never stopped. We adjusted to the situation, and we never stopped providing the healthcare services that our clients need and deserve. Without the support of people like you, we wouldn't be able to provide those services and fulfill our mission. So I want to ask you all to consider a very generous, sacrificial gift to support the Matthew Walker Comprehensive Health Center so that we can continue to provide the desperately needed services that so many of our clients need. I, like one of the scholarship recipients said earlier, believe that healthcare is a right. And I am passionate about the mission of the Matthew Walker Center. And so I hope that you will, again, consider a very generous, sacrificial gift, support the great work that we do every day to make sure that our clients get the care and the services that they desperately, desperately need. And thank you all so much again for being here. It means so much to us to have your support. Thank you.
So that ends our breakfast. Thank you so much. You all have a good rest of the morning.